Today, I am delighted to be in conversation with two fellow NLC alumni, Dr. Maggie Chery and Veronica Simpkins. Let's give them a round. Maggie is a board-certified internal medicine physician and recently pivoted to driving impact in the digital health landscape by joining Google Health as a health equity clinical specialist. Outside of work, she has used her voice to address racism in the healthcare system and center experiences of Black women and women of color to find culturally competent providers. And Veronica Simpkins is a nurse practitioner and international board-certified lactation consultant. She's the co-founder and executive director of Latched, a San Antonio nonprofit that works to offer quality, equitable care for pregnant families and families with children, including breastfeeding support, vital material assistance, and parenting education. So thank you both for joining us today. So this is to the audience now, a show of hands. How many of you all are aware, or at least have heard of the stark racial disparities in maternal health? I'm seeing some head nods, some hands, yes, yes. What about in access to care for even preventative screenings? Yeah, And it's true. Almost every report that we read really illustrates how communities of colors are disproportionately affected. So today, what we're going to do is focus on the items outside of the statistics. We know those, don't we? We're aware. There's documentaries, the reports, the research. And so what we're going to do in order to change the narrative around health and women of color, we're going to examine this topic with another lens. And keeping the convention theme in mind, where stories become action, because our own lived experiences can be the driving force for change, particularly as it relates to our health and healthcare systems. So there's a lot of areas we can go into today, okay? And we're all aware of these stark health disparities in Black and communities of color. So what I'm going to do right now is dive into the factors that contribute to these variances that folks may not consider. Specifically, health debt. Has anyone ever heard of this term, health debt? No? I see some folks not familiar. That's okay, that's why we're here today, having this conversation. So I'm gonna start with you, Veronica. Would you share, I actually wanna hear from both of you, would you both share what health debt is and what it looks like from your perspective? And Veronica, we'll start with you.
Yeah, hey, good morning, everybody. Thank you, Joy, for that wonderful introduction, and it's so nice to see all these beautiful faces and just be amongst these beautiful Black women. We're so happy to present this topic to you all. Healthcare is so important to me, so I'm just really thankful to be here. But when you immediately hear the word debt, what do you think of? Money, right? When we think of debt, we think of it's something that we owe someone else. It's usually money that we owe someone else. But today we really wanted to put a spin on it and really think of it as health debt is what you owe to yourself, right? Because when we think about things that are lacking, we need to think of really our whole body as a whole of what we owe to ourselves. So when we think of healthy and well-being, well, that doesn't just mean that I'm absent from a disease. It doesn't mean that I'm just absent from an illness. It's really thinking of my body as a whole, and that I'm not just surviving, I'm thriving in all areas of my life. So that could be with mental, that could be physical, that could be vocational, it could be financial. It could have many different avenues, but really we want to focus on what are those aspects of debt that are really causing harm against our bodies that we can focus on and we need to make better.
Thank you, Veronica.
Yeah, hi everybody. This is my first in-person speaking engagement, so if I'm a little catching my breath, this is a lot. So I'm just gonna put that disclaimer. But to piggyback off of what Veronica said, I think I'm gonna take a step back because while I love that we're gonna have this conversation, I think it always deserves context, right? So when you hear the headlines or you're going to a healthcare conference and they talk about health debt, they'll quite often start off by referencing the debt in regards to the pandemic and where we are, right? Because as a result of the pandemic and having to isolate, a lot of people didn't get their screenings, they changed their behaviors, their health conditions, if they had them, got worse. And we talk about in the healthcare world, how do we catch up to those last 2 years or over 2 years of debt? Now, in the conversation with Black women and women of color, there has to be more added to that, right? So even before the pandemic, our healthcare experiences were very different. They were not centered, and on top of that, if you're talking about access, did we really have access to culturally competent practitioners that were practicing cultural humility? Did we actually have quality of care? Were we being heard and seen? Were we given access to the same type of treatment based on what we believed was happening in our bodies? Didn't happen. In addition to that, we have to have the concept of weathering in this conversation, right? The daily cumulative stress that happens on our body from birth until our current age that actually impacts our health outcomes. So it's even before the pandemic, all the things we've been building that's been impacting our health. And the last component I think that has to happen in this conversation is community responsibility. A lot of us are advocates. We're putting everybody else before ourselves, right? Mm-hmm. We're advocates, we're caregivers, we're the first ones to take people into our homes, we're doing all these things, we're holding on to racial trauma that hasn't even happened to us, to people we don't know, but we carry it on our backs. Right. So for us to even have this well-being conversation and talk about health debt, we have to be recognized in our lived experience as Black women and women of color and make sure that's centered as we seek out care and as we care for ourselves.
Thank you, Maggie. Yes. And you all both touched on something about health really being holistic. And often among many Black and women of color, there is this hesitancy in being comfortable with wearing that self-care hat, with making sure you're putting the oxygen mask on yourself first, and grappling with breaking these generational cycles of what it means to be strong, and having that difficulty having a safe place to emotionally let go without feeling judged.
Right.
And that lack of empowerment to call out the trauma. It's trauma in various forms. So from your vantage point, how are you seeing this health debt? And you touched a bit upon it when you were going into the context. How are you seeing this impact these other areas of a person's lifestyle? How does that seep in? I'll start with you, Maggie.
I mean, it shows up every day. Like, think about when you wake up. I remember even waking up sometimes in a previous job and dreading going into work, right? And I practice medicine. It's something that I've always wanted to do. It's the first thing I said when I grew up, but I was actually dreading waking up, which also spells that I probably didn't sleep that well, right? Because I knew I was going to bed to go back to a traumatic workplace and have to deal with that again. Okay, if I'm not sleeping well, do I have the energy? Am I eating right? No, I'm probably emotionally eating and grabbing things as I go, which are not probably nutritious things, right? And then I'm sluggish. I think we have this aspect of Black excellence means you're resilient and you keep going and you keep producing. But are you really giving your best? Mm-hmm. Is it really, really your best? Right. Actually, I probably could give better if I had time to sit with myself and actually put myself first. So it impacts all of your lifestyle data, whether that's how you sleep, how you eat, how you care for yourself, how you exercise. There's no way, it's everything. It's like your whole being is impacted.
I agree, and I felt we were having this conversation to prepare for this conversation, and we mentioned productivity. People constantly want us to meet a quota, constantly want us to push beyond what our mental state can allow us. And sometimes it's okay to just say, you know what, I'm always running at 100. I'm okay to run at 90 today. I'm okay to run at 80. I'm okay to run at 70. I'm okay to run at 0 and do nothing. and that should be allowed. If I'm always running at 100, it continues to take away, a wear on our bodies. It causes us to emotionally eat. It causes us to miss that doctor's appointment that we've been pushing back for months. It causes us not to go to a dentist appointment for years because it's like my job won't give me time off. But all of those things are things that are wearing on our health debt on our body. Mm-hmm. We owe it to our body to pay attention to those signs, those early signs, those preventative things that we can be doing that we may get told like you don't have time for, but we owe it to our body to make the time for it.
We certainly do, and there's this term called weathering, because so many of us don't look like what we've been through. Is that right? Mm-hmm. So many of us don't look like the weight that we are carrying, and some folks have some extra melanin, so you may look a little younger than your years, but inside, Yes, fan clap to that. Thank you. Fan clap to that. But internally, there are things going on within our bodies that sometimes we choose to ignore. And I think, in our preparation for this panel, we talked about weathering and how it shows up and the sort of impact that it has. And Maggie, you want to touch a little bit upon that?
Yeah, I think even the concept, Dr. Arlene dubbed it, I think, in 1992. When people don't realize, when she studied it, she was studying even maternal and infant outcomes. And she was showing how, conceptually, for Black women, you were better off having a child in your teens because your health debt was at its best. Compared to white women, your best time to have a child was in your 20s or even late 20s heading to your 30s. Just from the debt. Like, I'm not even adding all the social determinants of health and all the other factors, right? It's another reason why you see, as myself, who's an educated woman, who has multiple degrees, I have higher risk of so many health conditions, including if I decide to grow my family, including hypertension and heart disease, right? Which is like opposite to what you expect, right? As I open doors and I have privilege and I can advocate for myself, I can know the terms, I should have a better chance at this. Actually, it's worse for me, right? So it talks about what this weathering really does, and it actually ages you. Like, I'm aging gracefully, right? Just saying. But inside, I'm older. Like, let that sit, right? I'm not the same, and I think we have to think about that. Like, our communities, we may look really good, but a lot of times you don't know what's happening in your body. And when I see that in practice is, you're late to come see me for your hypertension because you've been holding on to it. I read an example that I thought was perfect. If you think of Jenga, where you're taking out the cubes, weathering is almost like that, right? You build, and you keep taking them out, and you can see it, right? It's swaying a little bit, but it can keep going. You can actually keep building that tower until it all collapses, right? And that's kind of how you have to think about weathering. You don't even know when those things are getting poked at you until it all collapses. And a lot of times, those health outcomes look like heart attack, which you can die from, a stroke, undiagnosed cancer that could have been prevented or even treated really early, and we lose people we love very early.
Yeah. Absolutely.
I'll just add too, when we think about financial wealth, right? And we're all working to pay a bill, we're all working to pay student loans or any type of a loan. So it's important to know that the statistics are showing that most Black people die with a negative net worth. So it's important to know now, when we're younger, that we are making the steps that we can. We're making the steps that we can to provide generational wealth through our bodies. Right now, if you don't have life insurance right now, I encourage you to get a quote. Why? Because as you get older, yes, as you get older, it gets harder. You'd be surprised that after you have a pregnancy and you may have a C-section, your insurance company to quote you insurance, it goes up significantly. You'd be surprised if you even say that you have anxiety or you have high blood pressure, it goes up significantly. When you don't have those elements now is the time to get yourself prepared for the future so that your finances are in place so that you don't have to feel like you need to work to survive. You get to a point that you have worked, you're at your 100% all the time, and now I'm at a place where I can be at whatever percentage I choose to be throughout the rest of my life.
Right. Absolutely. I mean, they say more money, more problems, but no money, all the problems.
Yes.
So there are often unique barriers to finding culturally competent healthcare providers, including primary care doctors and therapists. And I can even recall making my own appointment to a telehealth visit and having this wave of relief wash over me when I saw someone that looked like me on the other end of the screen. Now, naturally, I would have been fine with any provider, but to know someone who looks like you and is more likely to be able to relate to you is just important because healthcare is such a personal business, right? So how have you seen these barriers in your experience as practicing healthcare providers?
I can start, and I'm going to take it two ways. So one, there have been many times people have walked in and they couldn't tell from my name if I was going to be, one of them. And I walk in and I literally see their shoulders fall down, and they take a sigh of relief. Or if they try to be real stoic about it and they have children, they'll, children will say whatever. They'll be like, oh, mommy didn't know you were black. And I'm like, I'm glad you just stated the obvious, which often helps to break the ice. But I like just even seeing that relief and seeing that they can be seen and heard and tell me or even admit, like, I know you're gonna get on me for my weight. I know you're gonna get on me because I haven't gotten my screenings, but I've been really scared. And I'm like, all right, cool, let's sit there. Let's talk about that fear. Where does it come from? Someone that was improperly diagnosed, a really horrible healthcare experience interaction, which led them to now stay away from the healthcare system. So that representation matters, right? I'm gonna give you the caveat to that. As a person who's pivoted from the practice space, there is a debt that we pay being in the system, right? And I, at one point, especially after the pandemic, had to say, I can't do this anymore. Like if I still want to be able to show up as myself authentically and actually still drive impact, I have to feed myself. And I have to figure out a situation where I thrive and don't compromise my needs in order to actually think about how I push equity for everyone else. Right. So I think in this conversation of thinking about finding that provider that looks like you, I think this is the right space to say we have to advocate for helping the system take care of us.
Right. Yes.
Because I have so many friends that are leaving, that literally have like signed, I have a numerous list of friends who have like resigned in the pandemic, like what I've seen, what I've experienced, I thought it would get better, it hasn't gotten better, I'm done. And I've walked away from that. And our system can't bear to lose those individuals. So we do have value and we matter, but a lot of us have to actually say, I can't, and I have to pause for now.
Right. Yeah, I agree. I think having my women's health nurse practitioner, people ask me, why aren't you practicing? You'd be a great provider, but I feel like my work was in grassroots nonprofit work. I feel like I can teach more women how to advocate against something that I worked within, that I know has systemic racism, that I know won't teach them ways to protect themselves if they're having a baby more in this avenue than I could being at bedside or being in the hospital. So I think it's also a point that needs to be made too is the relatability is very, very important, but there are people that look like you that's still not for you. So it is still very important to advocate for yourself, have an understanding, be okay with saying, you know what? I don't know if he had the most time to even talk to me. I'm going to get a second opinion. Right. That is okay. It is okay to fire your doctor that you keep telling that I'm having these issues and they are not listening to you. I can speak from personal experience that I was like, I'm having chest pain, and my doctor's like, oh, it's anxiety. I went to another doctor like, oh, it's your blood pressure. Oh, thank you. Thank you for actually listening to me. Thank you for, even though I'm a nurse and I know those signs, thank you for actually just acknowledging the symptoms that I'm actually telling you and tracking me and following up. So it's just very, very important to advocate for yourself, even with people that look like you. It's very important.
And hold space. Can I pick out? It's okay to completely hold space in that office if something doesn't feel right. So often what would happen is I'd see people, they'd go through, even in the practice that I was in, they'd go through things in the front desk or felt treated a certain way but wouldn't say something and it'd come back later, and I'm like, absolutely not. Like, well, I don't want to be that loud person or that angry person. I said, why? Because the system won't change unless we start saying things. And if you think about where we are today, it's when people started tweeting, right? And started putting their own narratives up, or doctors were sharing what patients would share that we all were like, oh, these really happened? This has been happening for so long. So I tell people, if you had a bad experience, I need you to find out which office you can report it to. And leave that, let it be documented about that experience. And that experience is not just the provider, it's the person who said hello to you at the door when you entered. So you name it from start, like we won't get better unless people name every single interaction where you felt unseen, you felt devalued, and someone wasn't hearing you. So you name it from the person who transported you to your room to the person who helped you get the taxi to go home. Everybody has to be held accountable.
Right. Absolutely, absolutely. And that's a wonderful segue into the portion of our conversation around advocacy. You know, as women of color, we're often advocating for everyone and their mom and their brother, and Tyrone too. And sometimes we do forget about ourselves, and there's this common adage that it takes a village to raise a child. So how do you see having community, having your tribe, really impact the health of Black and women of color?
I'll go ahead and start. I think, I have to speak now from a place of having partnership because I just got married in February. Fabulous husband right there. But I think going into a space of people who are like-minded, it makes a difference. And it also makes a difference to be around those that may not agree with you because it challenges you to just have a space within church. We have our marriage group that we attend. We have friends that were from college and people that are within our circle that we feel that we can trust, right? Because when we think about the struggles, some of the initial ones, if you're having financial struggle, you don't want to be that person that's asking for $5 to fill your gas tank. But you have to have those people that are your immediate circle that regardless of whatever the issue is, they're going to hold you up. And that you can have those discussions of how do you fix that area of debt if somebody may have something that's going to fix it, right? If you're struggling financially, we created a spreadsheet in Excel, right? That's something so simple that we can share with our friends if they ask, hey, we're working towards a budget, what did y'all do? So you'll be surprised if you share with your immediate circle who they can connect you with and why it's so important that within your circle, the advocacy will grow. Because one person will tell another, and then another will tell another, and now you have a Thursday night group that y'all are talking about something, that somebody with one experience is bringing it to the table for you all to learn from.
Absolutely.
Yeah, so I'm gonna do it two ways. I think if in the healthcare system, having that person advocate and having other people advocate for you is so powerful, right? And we saw that in the pandemic when we had to isolate and people couldn't advocate, and that's something that I lived through. It was extremely painful because even when you didn't have a voice, someone else in your community would have a voice for you. And so I think that in itself is powerful. For me as a black woman who's a professional, living in America, because there's layers to this, having my sister circles have literally kept me. Like one of my sister circle friends, Andrea, is in the room, and I think, and just even her being here, right? Like that's community care for me too, just knowing that she made the truck and was like, I'm gonna be here, I'm gonna support you, I'm gonna sit in the room. And there are times we have a chat together with other friends of ours where we meet up. Like I was just putting in the chat, we have to have a meetup. We have to have that circle because one, we have similar experiences in how we navigate the world, right? And some of my friends growing up can't relate to that, especially now as a layer of a professional, as all these things have gone on. So I think having that community where you feel seen, where you don't have to, there have been times I left meeting, I said, this happened. And you will think to yourself, I don't think that was that racist? Maybe it wasn't. I go right to the chat, they say, girl, you don't even have to say nothing. We already know. You already know what that was. Yes. And sometimes we may laugh at that, but that almost lets you woosah, because it plays with you mentally to be like, well, am I overthinking it? Maybe I'm being extra. Maybe my tone was a little too stern, right? To have people who say, no, you know exactly what that was. Find some space for yourself. Let me help you. Let me review that email so you can keep your job. She tried it. Yes. Let me do all these things because we got to keep the bag secure. We got to keep everything secure. And please, did you make your therapist visit, right? Having people who are telling me these things help me realize, you know what, I feel seen. I can talk to them for everything. And I think my last point to that is community is how I survived in the pandemic. And people who follow me on social media know that I've suffered tremendous loss in losing both my parents to COVID. And I would not be standing here today without community. Like having community, girlfriends show up, throw things at my house, financially show up, in so many aspects gave me time to say, fill your cup. Because what you faced is so heavy. If you think you're gonna keep going, you will fall apart and you may die. We have seen people die just out of all the stress that they've compounded on top of having tremendous loss. So I have to name that I'm standing here and still able to function because of community after the pandemic, and we have to hold space for that.
I really appreciate you both sharing the personal impact that having community and having your sister circles and your faith communities around you. And as I'm looking into the audience, how many of you all have that sort of tribe for yourself, whether it's NLC family or other folks, that you rely on your faith community? If you're a part of a sorority, fraternity, or community group, you have that. And some people may still be searching for it. I know there's different groups online for folks who may live in more remote areas. So those are some things to consider if you don't have that right in your city. And just thank you all for your candor, for sure. Because our friends, our chosen family, sometimes really lift us up and buoy us in these trials and tribulations that we experience from day to day. And also reassure us that we are not, we know what we're seeing.
Right.
We know what we are experiencing. That's so important. And what are you doing to make sure that you are successfully creating your best health life? I'm pivoting from broad to going in a little personal as we're closing out today's panel.
Yeah, so I depend on the person that's going to see every flaw in me, my husband. And I'm allowing him to hold me accountable to those things that I feel like I need to change. You know, if he's getting up every morning going to the gym at 5 a.m. and I hit the alarm, you know, it's okay for him to look at me side eye sometimes if I keep saying these jeans are feeling a little tighter, you know. But I'm really leaning on my circle to keep me accountable in those areas that I think are most important and that are going to affect my health. You know I want to lose weight. I know it's going to help me to have a healthy pregnancy. So I'm going to continue to try to reach those health goals. And when I fall off, I'm going to look to him to continue to help me, and my friends to do that, and my church to do that, and my sister to do that. So for y'all to do that, when you see me next asking, hey, ask a person, hey, you're my accountable person. Ask me every time you see me, how's it going? Give them that space to ask you to keep you accountable. That is one of the best takeaways that I can encourage anybody to do. Build your circle and allow them to have that space for you to keep you accountable.
Mm-hmm. Thank you, Veronica. Taking us back to lead with the accountability
Yeah.
partners. Maggie?
For me, it's been mental health. It's been prioritizing my mental health and being so intentional about it. Just to give granular, I had finished a fellowship, and everybody's like, what's the next job you're gonna do? You're leaving Harvard, and what are you gonna do next? I was like, there's no job. There's no job. And it felt so uncomfortable. I had to mute LinkedIn just to even be as honest as possible. I had to mute LinkedIn because I was like, well, I feel like I'm not being productive, right? I left this prestigious fellowship, what's next? But my whole being was like, you need rest. You are super exhausted. You just need rest. So I literally took, and I had the privilege to be able to do that. I mean, the credit cards weren't looking right, but I took 2 months. I literally took 2 months off. I took 2 months off. I relaxed. I took a solo trip. I sat with myself. I was meeting with my therapist. And then from there, it was like, okay, you had gained all this weight from the pandemic, so how can you take your mental and now make your physical look the way you want it to do? So then I started working on my physical health, and even when I started working, I put a cap on other activities I would do. Wouldn't do any speaking engagements. People would contact me, we'll pay you this. I said, nope. This is gonna be my time to focus on my body, my mental health. So I had a cap. I was like, by all of the rest of 2021, no speaking engagements, working out, mental health. When you're ready, when you feel like your cup is full, you'll get back out. And I didn't realize how hard that was gonna be, despite the fact that I told patients this all the time. So I had to eat my words, okay, Maggie, catch yourself. But being intentional for me was an example. And subsequently, I have so many girlfriends who have thus come and said, I did the same thing, because I watched you get back into your healing space, your thriving space. Right. And I think, that's the last point. The mental health for me was I noticed I was on survival mode even before the pandemic. Right. I was living on survival mode, which didn't make sense as a child of immigrant parents who was a doctor. And I'm like, yeah, I'm supposed to be thriving. I didn't realize I was carrying the burden of always thinking I had to survive. So for me, it was just now I'm hitting thriving season. Right. I'm going to thrive on my terms. Right. And I'm going to define what terms those are. So if the next thriving is that I'm taking 2 weeks off vacation, that's my thriving season. I get to define that, and putting my mental health first let me do that.
Yes.
Absolutely. You being an example to your friends, Maggie, really made me think about when you shine your own light, it gives other people permission to do the same. And so you're still being an example just by you thinking, I'm doing nothing, by resting. You're giving other people permission to say, I need to take a break. It's okay to say no, it's a complete sentence.
Right.
So as we close here today, what are some practical, tangible health debt to health wealth? And when you answer this question, just share what your definition is of health wealth. I'll start with you, Veronica.
Let's see. So for me, I really think about it in so many different areas, right? So the physical is important to me, the mental is important to me, the financial is important to me. I will say the financial is really important to me because we're trying to buy a house right now. So being really disciplined with a budget, understanding where your money's going, reading about books of how to take care of your money better, understanding that money is of something that we need, but we don't want it to be our why, because it significantly affects our health. Always feeling like we need more money, it's gonna make us happy, but it's not. So for me, having a budget, sticking to a plan, that's gonna help my mental. That's gonna help my physical. I'm gonna feel like I'm less stressed. I can take a vacation because I've saved for it, and I'm not gonna just feel like it's more burden being added to my financial, leaving me in a space of I'm unsecured. Because if I get sick, guess what? I can't go to work. And if I can't go to work, I can't pay my bills. And that affects my mental. That affects my physical. So for me, just making sure you have a plan, a budget. That's my focus right now. Budget, everybody.
Thank you, Veronica.
Yes.
I think centering yourself, even above your titles. I know there are so many people here that, are either political officials running for office, thinking about the next advocacy they're going to do, the next nonprofit. All that is great, but if you lay down and you don't feel full,
Right.
you don't feel yourself,
Right.
you look in the mirror, you don't know who you are,
Right.
it is not worth it.
Right.
It's just not. Like, the debt you put on yourself is just not, and that is something that I had to come to and realizing I can do all these great things, but if
Right.
Maggie doesn't feel full, if she doesn't feel like she is herself, what is she doing it for, right? And you pass that on. A lot of us will think because we have the money or we get the status, that's what you pass on. You will pass on the lack of identity.
Right.
You will pass on chasing things. So I tell people, chase yourself.
Right.
Chase knowing yourself. Put that first. So whatever that looks like, leaving a job, getting a therapist, getting your body first, having a budget, whatever that looks like, it can only be defined by you. And once you do that, you're only going to head in the right direction.
Thank you. Well said, well said. Maggie, Veronica, thank you so much for sharing your time with us today. And I think that we all left with some action steps that we can consider and implement. Yes, see some head nods. Okay, great. And I want to thank all of you in the audience today for joining us this morning and being such a great audience during today's panel. And we invite you to join us in our breakout session where we'll take a deeper dive into creating your own personal plan for health. Well, thank you so much.